Facelifting, technically known as facial rejuvenation or more technically rhytidectomy, is a procedure that is designed to make your face look younger. When patients come to me for this procedure, and it represents a very large portion of my practice, they tell me what they don't like. They tell me their jowls are hanging, or their cheeks are low, or they have wrinkles. When patients tell me what they don't like about their face, that doesn't tell me what they do like. It does tell me where I should be working, but personal preference and surgical skill are two different things. I don't know a patient's favorite color or favorite food after meeting them, and I don't know what patients want to look like just by speaking with them. It is very important for me to know exactly what you want as a result of your facelift, rather than for me to make the decisions, never having seen a picture of you when you were young. When doing a facelift, I rarely simply make the incisions, pull the skin tighter, and sew it up. That's not a facelift. That's a skin pull. Most patients do not benefit from that at all. A facelift involves manipulating the tissues under the skin, moving fatty tissues into a higher position, a younger position, filling areas that became thinner with facial aging, perhaps putting a chin implant in, perhaps putting cheek implants in. Usually I do fat injection with my facelifts because tight and young are not the same thing. Simply pulling the skin tighter is not going to make you look younger. It is possible to do this to a child's face. The skin isn't tight. Things are in a younger position. And putting things back into a younger position is a real facelift. We all know of certain people in the public eye, movie stars perhaps, that do not look quite good after having one or more facelifts. Now we would wonder, how does this happen? Don't they have the money to go to a good doctor? Well, of course they do. The problem is, in general, doctors think they're supposed to know what to do. When I was a surgeon, before becoming a plastic surgeon, if a patient came in with certain symptoms and their blood tests showed certain things, I told them what was wrong and what needed to be done. But that's not the same in plastic surgery. In plastic surgery, it's what the patient wants. And if I operate on someone without knowing what they want, it's only going to happen by accident that they get it. I need to see a picture of patients from 15 or 20 years earlier when they loved how they looked. My job is to make people look like the best picture they took 10 or 15 or even more years ago.